Hey everyone, it's Heather and Corey here from One-to-One Physical Therapy, and we wanted to put this video out to show the influence that the bite has on the postural system. In this case, particularly the neck and the shoulder, and how influencing the bite can impact the range of motion and alignment in these areas. So we're going to do some baseline testing of Corey's neck. We're going to start out at OA side bending. And I'm trying to side bend her to the left, which I really can't do, but I can go to the right. I'm now going to go around C4 and side bend. I'm trying to side bend left, and that's pretty restricted, but I can go full to the right. If I go to about C7, C8 and try to rotate to the left, I can't. I can rotate to the right, which is full. And if we look at shoulder internal rotation, this is about as far as we can go. Now we're going to see what changing her bite pattern will do. So we have this bite plate, and they're very inexpensive. We get them at Patterson Dental. And I'm going to have Corey just tap a little bit. And I want you to think of teeth not just as structural entities, but they're sensory. There's tons of sensory neurons and information coming from our teeth to really also help us tell us where we are in space and give us postural information. So we're taking Corey out of her habitual bite pattern, giving her a new frame of reference, and let's just see what her postural system does. Does it like this? So look at her OA side bending to the left, which is full, and it's equal to the right. Her mid-cervical side bending to the left is now full and equal to the right. Her lower cervical rotation is full to the left and to the right, and it's equal. And her shoulder internal rotation now is full. And that happened in a split second. As soon as she put that in her mouth and tapped, her nervous system completely adjusted how she was aligning at her neck and shoulder and changed her range of motion. So let's take that out. When you're trying to determine if the bite is influencing the postural system, sometimes that won't work, and you may need to play around with a couple different testing items. So a popsicle stick or a tongue depressor is another one to try. We're going to put it on the left side and just see how changing the input there, giving more sensory information on the left, could influence things. And I'm trying to go left and she's locked up again. I can go right. Left is locked. So she's basically reverting back to her original pattern. And you can see really clearly with the shoulder. So let's switch the input and put it on the right side. Okay. And she's unlocked again. So Corey's system actually prefers more input on the right compared to the left. Now, if you're working with a dentist, this information can sometimes be helpful for them in terms of helping them with their adjustments. But ultimately, when you do the adjustment and you're working with a dentist, it results in neutral and full range of motion at the neck and the shoulder. And if we were testing down below, we would probably also see changes in the hip and the pelvis. But if you're working with a dentist, and even if you're in the dentist's office, it's sometimes hard to test that. And really, these are the only things that you can test at the time. So we encourage you to try to work with dentists because you can see the influence and the power that the bite has on the rest of the body, and that there are many patients out there that need this integration. So we hope this was helpful, and thanks for watching.